Welcome, you guys. We're back. Today we have a really fun episode with an OBGYN. It's Dr. Brianne Kling. And we are just so excited to have her on. But as you guys all know, we are the Miles and Moms podcast, a podcast for moms chasing goals through all seasons of life. We're Shanna.
I'm Olivia.
And then we have our guest.
Hi, Dr. Brianne Kling here.
Hi.
Yes. We're so excited to have her on. She's a wealth of information. We've had a lot of questions, based around pregnancy and postpartum running. So it's just fun to have you on, Dr. Brianne. But yeah, as we were saying, pretty much we're bringing you training tips, mom and expert interviews, and all kinds of best friend banter that makes you feel like you're on a run with us. Whether it's your first 5K or your next marathon or a stroller tempo, we've got your miles and your sanity. Since we're building a new platform, we'd really appreciate it if you can rate, subscribe, and share our podcast with another fellow mama. Please, please, please. We want to get this out there. We have so many expert interviews coming your guys' way. And the more that we can just educate other moms and show them that, hey, we can run in all seasons of our motherhood, the better that we'll all be. So, but yeah.
Well said. I love that. That is so true. I have an everyday hero shout out, because moms are seriously heroes. And this one is from Carolyn Belozos. She's marathon_mama_ on Instagram. And she submitted a why she runs for our podcast, and it says, I've been running for nearly 20 years, but I went full steam ahead in 2024 after 4 years of pregnancy and nursing. And now I'm running faster and stronger as a mother runner than in my 20s. When I think about my why, I always think about my kids. I want to lead by example and show them how to learn from setbacks, how to set scary goals, and how to find community within your niche and how to achieve success. Do I have to run marathons to teach them these lessons? No way. But I love running. I love the community. I love how it makes me feel. I love exceeding goals, and I love that I can do it anytime, anywhere. So I can do something I love while teaching my kids valuable life lessons. One of the most rewarding things that I did this year was start a run club specifically for mother runners in our community, because when moms support moms, anything is possible.
That's so cool.
That's so good.
I love
that. That would be so nice if everybody had that mentality. Everywhere they went, they just were like, hey, we're going to bring that's what got me back into running, was a group of moms in a neighborhood, literally.
Absolutely.
So it's crazy. Yeah. Well, how's everybody doing? What have you been up to? What does your week look like for you, Dr. Brianne?
Well, this week is a little off kilter because my kids are on fall break. Yeah. So, and when they're on fall break, the babies don't stop. So we're just trying to manage getting to parent-teacher conferences, getting to soccer practices, but then maybe dropping them off and going to work for a little bit. So it's the schedule is always like a juggle, right? And thankfully I have the world's most supportive spouse that is just picking up my pieces in the background. Yeah. But it's been a really good week, and it's been fun to be able to spend some time with my kids too, which is great. And I've gotten beautiful fall weather. It's finally fall weather in Nebraska.
Goodness. Yay.
So the heat, we've been in a heat wave for a long time, and it is perfect in the mornings. So I'm loving all of it.
That's wonderful. That's so nice.
Yeah.
How does that work when you are you on call, or do you if one of your patients?
Yeah, ours is pretty unique. So I have about 20 partners, which is a lot. So most practices you get delivered by who's ever on call that day. We do like to deliver our own babies still, though.
That's cool.
So yeah, so I'll make about 90% of my patients' deliveries. Obviously, we're not, robots. We're not superheroes. And so, you're going to miss things for soccer tournaments, vacations, different things like that. And then we each take call where we have to be in the hospital the whole time. And those people are delivering for everybody who might be on vacation or can't come in. So it is pretty hectic. I mean, every night when I go to bed, I don't know if I'm working that night because somebody might just roll in and they'll call and be like, we need you here right now. So I'm very good at waking up very fast.
Yeah.
Jumping in my car. Yeah.
Gosh, yeah.
So it's not a lifestyle for everybody, but you get used to it after a while, and it doesn't bother me anymore.
Wow.
That's
Yeah. I mean,
impressive.
you would have to be really good at like, not being groggy, just
Yeah. I listen to a lot of music and I roll the windows down.
Smart.
Yeah.
wow.
So, and then, if I'm ever like somebody in labor and I'm doing a run, then I pick a very small loop and I just loop around and around because if they call, I got to jump in my car and go.
Oh my
So,
God. I was so
that's
curious
not-
what
I'm
that
not
was
yeah.
running.
Yeah. I mean, I'm not opposed to like running laps around the outside of the hospital too. We've got like a little walking path and they'll just be like, there she goes again.
Wild. That's so cool.
Oh, we're moms who run, right? You just
Yeah.
figure it out. You just figure it out.
So true.
I love that
So-
so much.
Yeah.
If this doctor could do it, you guys, I could do it. You could do
Yeah.
it. Like,
Yeah.
Yeah.
I love that. I love that you're making laps around the hospital. Like,
Right.
could
right.
you imagine your patient upstairs? You just deliver. They're watching you run around.
I know.
They're like, she just delivered my baby, saw my vagina and all, and here she
Yes.
is just out running like it's no big deal.
It is. My patients always, they're like, you are the craziest person we've
That's
ever met.
awesome.
And they
I
know
love it.
that, I'll do a delivery at 4 a.m. They're like, can I go back to bed? I was like, no, I'm going to go for a run. I was like, so I got to be back here at 7.
Oh yeah.
That
They're
is
like, what are you doing?
I gotta ask 2 questions because I'm curious. What music do you listen to when you have your window rolled down? And then how much caffeine do you have?
Weirdly enough, like I drink only 1 cup of coffee in the morning.
That is
because for one, by the time I'm in the car, they probably needed me 5 minutes ago, so I don't have time to make the coffee.
Yeah.
So it's just coffee in the morning. But I'm grew up in the 90s, and so like hip hop barbecue, anything
Love
that's like
it.
Tupac and Eminem, like that's a lot of my playlist.
I like hearing that. I want my OBGYN to be listening
Yeah.
to Tupac on the way.
Oh,
Yes.
yes.
That's the energy
yes.
that I want.
Yes.
Yes.
Yes. Lots of that.
Oh, I
So-
love it.
So awesome. That's
Yeah.
so my jam. That's
Yes.
me.
Yeah.
Any 5:30,
I mean, that's a
5:45.
hype music.
Yes.
Yeah. Right.
Windows rolled down. I want it blasted like I can't hear back in
Yes.
the 19 whatevers, and
Yes.
just wake me up.
Yes. Dre, Tupac, Snoop.
You're
Yeah.
awesome. That's so rad. Oh man. Well, I could go ahead and roll into. Well, actually, Olivia, you have some news. How is your week going?
Oh, I was like, I do? Am I announcing?
Yeah, you do.
Yeah, I know. I leave for Chicago tomorrow, so
That's so
very-
exciting.
I'm very excited.
I ran Chicago last year. It's so
Oh,
fun.
you did?
Oh
Yeah.
my gosh. I did it 2 years ago, and it is, it's, usually I'm like, oh, I don't know if I would repeat a race, but I remember
Yeah.
the second I was done, I was like, I can't wait to do it again. Like, it's the
Oh my
only
gosh,
one
the-
I've ever felt that.
The crowds there are so amazing.
Yeah.
It's nice and flat. Is the weather supposed to be good?
It's supposed to be good as of now. So,
Good.
yeah.
Good.
I
Yeah,
know, like
know.
50s.
I
But,
know.
I kept saying if it's lower than 67, I am fine because I've trained
Right.
at 67 and humid. We got these random humid days every time we do a speed workout every time. So I was like, I will be fine. And yeah, so it's supposed to be good. And also just with I keep telling myself the energy of the crowds, it's gonna just
Oh,
propel
it's
me.
so awesome there.
So-
That's such a great race.
I'm very excited. I have a lot of weird energy today, so I'm just like on and off.
You got the paper crazies.
Yeah.
Yeah.
And I haven't run today yet, and I'm like, I should, but I'm also like, does it even matter anymore? Like,
Yeah.
and it's normally
Yeah.
I'm very like, I'll just get my run done and all of that, but I need to pack, and I've just kind of been avoiding everything, and
I always avoid packing too.
yeah,
Yeah.
It's like the biggest dread of any out-of-state race.
Oh,
yeah.
I know.
For
How
sure.
many
know.
shoes
Like-
should I bring? Even though I'm running one
Oh, I
race.
know. I know. Like the amount of gels that I pack, I'm like, am I really gonna take all? I can't even fit all of these.
Yeah, so
Like
true.
all the nutrition, I'm like, what if they don't have Gatorade in Chicago?
Oh, yeah, exactly. So true.
What the heck?
I'm kidding. Although I will say, if you walk into like any Trader Joe's or anything, they're all out of bananas, and everybody's in the peanut butter area. It's so funny because it's just crowded with.
Awesome.
And I'm like, oh my gosh, this is so funny. Everybody just crowds to the same things. It's a good
Right.
thing that I don't like bananas because otherwise,
Yeah.
field
Yeah.
day. I'd be packing bananas in my backpack.
Oh, I know. Well, these bananas too can get through TSA, like for the people
True.
flying. And
Yeah,
they pack their
right.
own. They're just, bananas and bagels like the whole time, just
Yes.
eating everything.
Yep, it's so true.
I think that's how you spot the marathoners in the
Yeah,
TSA line.
yeah.
They're carrying like a
Yeah.
bag of bagels and their pretzels and their bananas
Yes.
and their shoes
Yes.
are thrown over their shoulder because they
The
can't
shoes,
risk
like-
it
Yeah.
getting lost.
Yes, all their racing stuff is in their carry-ons. They've got
Yes.
everything
Yeah,
because they don't want
exactly.
anything to get lost.
Yep.
So true. That's my
Oh.
number one thought. I'm like, okay, the shoes have to be on like right on top.
Yes.
In my carry-on. They will be in my eyesight the whole time. Nothing's
Right.
happening. The shoes are coming with me, and because everything else I feel like is manageable. I'm always also like, if I chafe, so what? It's one race.
Right.
Shower after is so much worse. It's just the shoes is like the main
The
thing.
shoes. Yeah, for sure.
Yeah, just watch. I'll
Yeah.
forget them. I'll have to go buy new ones. I'm like, I haven't even gotten them out of the box yet. So yeah, I'm very excited. We were supposed to fly out tomorrow night, and we bumped our flight to tomorrow morning. Just
Yay.
yeah,
Good.
very.
Let's get out of here.
just-
Yeah.
The second
Let's
that
roll.
grandparents get here, it is time.
Yeah.
Yeah. So
Oh, well, that's so exciting. Super
So
excited
exciting.
for you.
yeah, I'm excited. I'm anxious. It's like, I think the travel part is just anxiety inducing anyways. And then also like saying bye to the kids. And once you're over that hurdle, I think I'll feel a lot better. Cause right now it's just, Charlotte has a lot of weird energy. She's also lots of crying and things like that. And then my son is just crying so much. And he keeps going, I only have one mom. And I'm like,
Oh.
not good. 'Cause,
Like, thanks.
yeah.
Some mom guilt.
Did we buy him an a ticket? I was like, we have to take him. He's right. He does only have one mom. I can't bring
Yeah.
Charlotte because she's acting too weird. But
Yeah.
so yeah.
Oh, man.
So once we're done with all of that, I think it'll be a lot better. And tomorrow we'll be pretty tired. See, I'm not as good. I'm not as good as you as like waking up. I'm pretty groggy when I wake
Yeah.
up. So it's like a whole
Oh, I'm
thing.
just, yeah.
Yeah.
It's a whole process.
Yeah. I
I remember
think
when I fly to, make sure you sanitize. I was like so afraid of catching something on the plane.
yes.
I would like wipe down everything. I was like carrying a bottle of Purell, like just like spraying
yeah.
everything.
that's gonna be
Like, do
me.
not get me sick right before
Yeah.
this race.
I was saying I was like gonna
Not.
go full COVID 2020.
Yes.
Oh yeah.
in
Oh,
mind.
yes. Yeah, faithfully. We flew to Berlin. We did the Berlin Marathon, and I had a mask on the whole time. I'm like, I have made it this far
Yes.
without getting sick. I
Yeah,
am not
so
getting
true.
sick now.
Yeah.
Oh, that'd be such a
So-
bummer.
Did you
Oh,
just do
right?
Berlin?
Huh?
Did you just
No, we did Berlin, and no, we did that 3 years. We did that one 3 years ago.
That's so
Okay. Wow.
cool.
Is
Yeah.
this your running group that you were talking about?
Yeah. So yeah, there was like 25 that went to that one, to the
Wow.
Berlin one.
That's a
Yeah.
big group. Yeah.
Yeah. So I was saying we have a group of female physicians on Facebook that we all, encourage each other in training and different questions, but we meet up at races every year. And so we'll meet up at Berlin. A huge group is meeting up at Chicago. We did every women's marathon a year ago in Savannah, and there was 52 or 53 of us that went to that one.
Wow.
Yeah, we make our own swag bags. Everybody brings stuff from their home state and
Love that.
dinners, and it is so much fun. It's so
funny.
much fun.
That's
That's
Yeah.
so cool.
That's like a very powerful group of women
I know.
Yeah,
meeting up.
Yeah.
It's insane.
yeah,
So
yeah. It's pretty. My husband's like, you guys are kind of intimidating.
Yeah.
But then the other husbands come too. So when we did Berlin, there was like, we met a bunch of women. They were all there with their husbands, and we all like went to Oktoberfest together, like in Munich. And
That's
oh my
cool.
gosh, it's just a ton of fun.
Incredible.
That's so rad.
Yeah,
This is encouragement for anybody that's listening. Find your group of women and go to a race.
Yes. And they all have kids too, so everybody is, you're all in the same boat. So it's super encouraging. Like, well, if they can do it, like I can do this.
Yeah.
Yeah.
Yeah, I love that.
Yeah.
Let's get into her bio.
Yeah.
Because clearly we're all loving this woman already. But she's got a lot to her and she's got a lot of knowledge. So we're super excited to dive into it. So Dr. Brianne Kling, she is 45 years old, which I would have never thought you were 45, by the way.
Oh, bless her heart.
Yeah. Born and raised in Fargo, North Dakota. I attended the University of Nebraska, Lincoln, where I received my bachelor's degree in biology. I then attended medical school at the University of North Dakota, and finally finished my residency in OBGYN at Banner University Medical Center in Phoenix. I have been you've been all over. Oh my goodness. That's so crazy.
Yeah.
I have been a practicing OBGYN in Omaha, Nebraska for the last 15 years and really enjoy the large I'm going to say this word, obstetrics.
Obstetrics.
It's one word. I'm like, just say OB. Just say OB. Don't even attempt it. Part of my practice. I am married to my wonderful husband, Mike, and we have twin. Oh, I didn't know you had twins. We have twin 10-year-old boys, Cruz and Rocco, and a soon-to-be 7-year-old daughter, Gia. That's cool. I have twin boys, too. Mine are 5.
Oh.
And they're boys, yeah.
They get easier.
Oh, good to hear.
Yeah, they're crazy in the beginning.
Yeah. Yin and yang. One is crazy and the other one's really nice. I enjoy my running, obviously, being outdoors on our lake, camping, reading, hiking, truly anything that gets me outside in nature. I started running when I was a resident, as many of my co-residents were collegiate runners. Wow, that's awesome. We even started a Gyno Girl Runners, so the group that you're talking about, which is so cool. And we have a ton of fun. I have completed 6 full marathons, and I have done many half marathons to count. I am currently training for a local half marathon and also the London Marathon in April 2026. My goal is to complete all of the world majors. Running and also just exercise in pregnancy is something that I am passionate about, and as it combines 2 of my favorite topics. I really look forward to chatting with all of you. And that's why she's here, you guys, because not only is she an OBGYN, but she is a true runner herself.
Yeah.
It's so cool.
That's awesome.
Not a fast runner. Let's put that out there,
pace
too.
is not relevant.
Yes. Yeah. But definitely a runner.
You cross any finish line of any distance, you are a runner.
Absolutely. Absolutely.
Wow. London, that's exciting. Wow.
Yeah. My husband's kind of gotten on the running bandwagon too, so
thank goodness.
So he's done it. Yeah, thank goodness, right? So he's going to do that one too, and it kind of coincides with our anniversary. So we're just going to stay over there for a while and do some sightseeing and stuff like that.
That's awesome.
Have you guys ever been to London before?
No, the first time that we were in Europe ever was when we ran the Berlin Marathon.
Wow. Okay, cool. That's going to be so fun.
And Europe is amazing. I loved it.
Yeah.
That's so awesome.
Great. What a cool way to see it, too. That's going to be amazing.
Yeah. That's it's brought us to a lot of places. I'm sorry, my dog's trying to get in.
I was like, is that a kid or a dog?
Oh my God, it's a dog. And I told the boys, I was like, keep the dog out.
It's okay.
Sorry about that. It is a great way to see the world. And it brought us to a lot of places that we probably maybe wouldn't have picked except for a race. So
that's so great. That's so neat. All right. Well, let's get into the questions. We'll start off with the big one of what is the current medical thinking on running through pregnancy? So, I mean, I think we've talked a lot about our personal experiences of running, continuing running when you find out that you're pregnant. It can seem really scary first trimester. There can be a lot of just fear with that. So what is your professional standpoint on that?
Yeah. So, and I'll lead off the conversation just first kind of putting the premise out there that everybody's different, right? And everybody should consult with their own personal obstetrician because everybody's background's different. But when it comes to running in pregnancy, especially if you have always been a runner, we are huge proponents to continuing that running through all phases of pregnancy, right up until the delivery. And then obviously there's a little bit of recovery and everything based on the delivery, what type of delivery you had. But yes, running and exercising in pregnancy is a 100% go.
Amazing.
I love
Yeah.
that. With going off of that, so is that like more of a, I guess, modern day push or practice as far as like, like the grand scheme of like the OBGYN like realm? Because to say this, like I have obviously 6 babies, so 5
Yeah.
pregnancies. And I had a doctor or an OBGYN who, I mean, he was in his 70s. He was an older man. He
Right.
was kind of a
Right.
fill-in. So I was actually seeing this other lady who was, a little bit younger, but more like up to date, I feel like. And being a lifelong runner, I've been running since the age of 5 at a pretty competitive level. And I remember asking him on my second pregnancy, I was like, well, I kind of want to go a little bit more in on this. Is it possible? And he's like, oh, just nothing above this heart rate. And I was like,
Right.
this is so different than what my other doctor tells me. And so I'm curious, like, has that been like a shift? Have you seen a shift in
Right.
your practice?
So definitely, I think that exercising and running in pregnancy, a while ago, everybody used to have been like, pregnancy was a disease, right? Like, don't do anything. We don't want you to move. We don't want you to hurt yourself. And we've actually, found that all of like the running and the exercising can help improve so many aspects of it. So especially if you're seeing a physician that is up to date on all of those things, they're definitely going to push you to keep doing those. I do think that, when I first started practice, it was a lot about heart rate.
Okay.
But as you guys know, like everybody's heart rates are different.
Yeah.
I mean, somebody can run a marathon and not go over 150, and somebody could maybe walk a flight of stairs and hit 150.
Yes.
And so, right, so you're not going to be able to use necessarily that heart rate training. And so when I talk to my patients, we really use like a relative perceived exertion scale,
Love that.
like 1 to 20, where 6 is no exertion at all, 20 is max, right? Like that's where you're going to be your threshold type runs. Ideally, you would like to keep most of your runs between 13 to 16,
Okay.
right? And that's based on what you do. When we talk sometimes about heart rates, a lot of people who are active runners or active exercisers, they may know kind of what their max heart rate is, right? Like, okay, if I'm going to hit a max threshold run, this is what I'm going to hit, and maybe keeping it under 85%, like 85% of max. Can you go to 90%? You can for short bursts of time. But, when we do talk about that, then blood starts shunting to your muscles and can shunt away like from the placental flow. But that is immediately corrected once you're done. And most of us are not going to run at 90% of our heart rate for very
Yeah.
long. We just
Yeah.
can't do it. Like, even
It's-
if you're not pregnant, that's
Yeah,
too
Yeah.
hard.
exactly.
Especially being pregnant, like I've noticed even speed work itself, like anything over 3 minutes of a rep, I'm like, I shy away from.
Abs-
I'm like this is
yeah,
uncomfortable. I have to pee again because my body is just
absolutely.
all over. So I'm like that. I totally
Right.
see it. Yeah.
Yeah, absolutely. So, and plus, as you get more pregnant, the body is naturally going to slow down.
Yeah.
And so, right, like the uterus is pushing on the lungs, the cardiovascular system is different. You might pee your pants more, like different things are going to slow you down, whether or not you want to or not. And so those types of things are normal physiologic processes that happen in pregnancy. Now, obviously, if you're training, I actually read this great stat that there were 17 Olympians that competed at the Olympic level while pregnant.
Crazy. Yeah.
So those are going to be a little bit different, and those people are being monitored very closely. But yeah, the day-to-day mom runner that's just looking at moving her body still, right? Like pregnant women are not delicate flowers. Like I don't know if I can say bad word. We're not.
Yes, you can.
We're badasses. Like, come
Yeah.
on. Like,
Say it
we are
out loud.
carrying these babies. We're doing all of these things. I'm not a delicate flower. Like, I can go out and do this.
Yeah,
So,
that's great. Do you feel like if you have a pregnant person that always been running. Do you tell them as they go on within their pregnancy? Are you guiding them with, I mean, of course, you can't like coach them, but are you saying like, okay,
Right.
watch your exertion level as you enter your third trimester or anything like that? Because some people will
Right.
take it into their third trimester, still speed work.
Yeah.
Absolutely. So I think that the initial conversation happens right in the beginning. And if they are continuing to do that in the first, second, and third trimester, they can continue doing that if they feel comfortable. Now, various modifications as you become more pregnant, they've gotten really great with like running maternity belts. So I think a lot of it, right, is like the shape of the spine and the laxity of the joints in pregnancy. And so you're more prone to injury of those areas. And so definitely making those accommodations to just keep your body feeling good while you do it. This never wants to be a point where you know, quote unquote, push through the pain, right? Like that's not what you're going to do when you're pregnant. So you really have to be more in tune to your body. And if something is hurting or not feeling good or various other different things that we can talk about, you have to stop.
Definitely. Do you
Yeah.
think
But I had a patient that ran 5 miles the morning of her induction
Oh,
and then
Wow.
came in and had a baby.
wow.
And she rocked it. Like
I
I've
bet.
had patients do half Ironmans while they were pregnant and they're like, thank you for just like, being that doctor that supports those things. But that was their normal.
Yeah.
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 Definitely.
So we don't recommend anybody pick up an Ironman training program when they find out they're pregnant if they've never done one before.
It's not the time to look like a badass. Like
No, like
definitely
you already are a badass. Like
yes.
you already are
You're
there. We
making a
don't need to.
human. Yeah.
Yes, yes,
From
yes,
scratch.
yes. From scratch. That's the
Like
best word ever.
listen, I just I mean, honestly, I had that struggle. I was in marathon training, the last 4 months, and it's like a bittersweet moment, like leaning into this last baby, and then also seeing like your good friends go off and run this marathon
Yes,
you were
yes.
training for. And
Right.
I still have in the back of my head, I'm like, I'm gonna still run that marathon somewhere, find a
Yes,
location.
yes,
And I keep reminding myself, I'm like, just because I can't physically see what's going on inside, like, there's some badass shit going on inside that belly.
right, right,
And I
right.
think it's just, it's hard for us as women because I think it's just a part of us. It's like our period, right? Like our menstruation cycle, it's always been a part of us. And so we don't realize how like phenomenal it is that our body is
Absolutely.
doing that and that we're training through that. And it's the same thing with pregnancy. It's like, I don't like that is our standard. I don't know, like that's our bragging
Right.
point. I don't know.
Yes, that's our superpower. Like
Yeah.
we have these superpowers, and that is it.
Yep.
So, exactly.
That's so true. Yeah. It's so crazy to think about. When I found out I was pregnant with my son, I was told not to run with or not to do anything with a heart rate over 140. And so
Yeah,
I'm still hung up on that. And I'm like,
That's
yes, right? That
nuts.
yeah,
used to be it.
yeah.
The 140 used to be it. And it's like the heart rate, so you make so much more volume, right? And you retain so much more fluid. And so the resting heart rate naturally will slightly increase. And like to do 140 is like, how are we supposed to do that?
Yeah.
Yeah.
Right?
That was just
Like we're just
walking.
gonna zone two
Yeah.
train the entire
Yeah.
time. Just kind
I
of
know.
jogging around.
It's crazy because that was 5 years ago. I will say the provider that I had, I mean, I'd say she's more old school, but I mean, she works with so
Right.
many people within a practice. I'm sure that they've all discussed it. I think it's very much just a guideline that she was probably taught.
Right.
And so it's just,
Well, and really like a lot of obstetrics, right, is like, well, these are what we recommend for everybody. But
Yeah.
again, like each patient is different, each pregnancy is different, and that has to be titrated to that person. So I would never have recommended, like I said, my patient who did Ironmans would never have recommended that for a patient that was just like more sedentary or something like that. And so, if you have somebody that's training for a marathon, right? And then finds out that they're pregnant, it's like, well, what do you think about this? I'm like, let's go through it. So now a marathon pregnant is harder and needs to be because of the duration, really, the duration, the electrolytes, the dehydration, like that kind of stuff. And so I would say that that's harder strictly because of the duration of the activity.
Yeah.
So, yeah.
It's
Yeah.
probably like a good time to adjust that, right? If you are training
Right.
for a marathon pregnant, which we had a lady on just the other day that is, and she talked about all the bathroom stops she had, the
Yes.
extra fluid
Yes.
she's taking in. And I love to
Yes.
hear that,
Yes.
walking if you need to. Like
Yes,
it's not the
absolutely.
time to PR, but it doesn't mean that you can't still get out there and move your body, It's
That's
just gonna look
exactly
different,
right.
right?
You just have to make modifications. And you're exactly right. You hit the nail on the head. I feel like, when you're a runner, you're always looking to improve that time, right?
Yeah.
And so the goals need to shift a little bit and again, like realize, right, you're growing a human and how badass you are for doing that and then continuing to race and do this marathon. And so those modifications need to be had.
Yeah.
But
Definitely.
it doesn't mean that you can't do it.
Yeah.
I love
Which
Yeah.
is
that. I love
yeah.
that. I think so much of that is probably fear based. And,
Yeah.
Absolutely.
I think people are probably also I bet more people would feel comfortable to run a marathon if the optics of it also didn't look so like selfish, I guess. I
Yeah.
think that would
Right.
maybe
Right.
what they would think like, oh, is it selfish of me to go do this, but
Right.
realistically, it's of course not. So that's so
Right.
interesting. Do you think that being a runner helps people in labor? Do you think that it makes them
Yeah.
Yeah.
So we know, right, that any form of exercise, and obviously we're talking about, running, definitely improves outcomes, right? So just pregnancy overall will decrease your incidence of gestational diabetes, will decrease your incidence of hypertensive disorders. We know that their endurance is better, and they even say like your pelvic floor is better. It's stronger when you exercise. And so all of those things help improve outcomes. It's tough because there's not a lot of conclusive studies done. They actually did do a couple studies of two elite athletes,
I
like
saw
when they
that.
were in labor.
Yeah.
Yeah,
Oh,
where they monitored baby and had them like run while
Yeah.
they
whoa.
were I can't right running while they were laboring to just
So
take a
crazy.
look at what was happening to the baby and different now it's the end of the study is two. So, but yeah, the people do better. Now, in saying that, right, there's contraindications for certain people as far as continuing to run in pregnancy that I just wanted to tap into just a little bit. And again, talking to your provider, any form of bleeding, we don't want people running. If they're carrying multiples, that's a different thing too, just the stress on the body. Yes, you knew that, I knew that.
Yeah.
The stress on the body is cervical insufficiency. So if you have cervical shortening, that we don't want any more pressure put on that cervix for the risk of preterm birth. Um, Uncontrolled diabetes, uncontrolled thyroid disorders, or uncontrolled cardiac conditions, including high blood pressure or hypertensive disease. So, and these are kind of things that, maybe like, well, yeah, duh, right? Like, don't do that. But it's good to bring those things up and to be able to talk with your physician. They also talked a lot about the one thing that we talk a lot about in the first trimester is heat. So if you are training in a really hot environment, we do know that core body temperatures actually can affect first trimester organ growth if the body gets too hot. That's
That's
also why we
crazy.
say to our women, we don't want you sitting in a hot tub, right?
Yeah.
We don't want the body, over that 101, 102 degrees. So we don't, the hot yoga, that those types of things, delve into those. We're like, we don't want the super hot environments.
That's crazy. I always wonder why
Yeah.
that was a thing, and that makes total sense.
Yeah. So it's a lot of like organ development, first trimester. Also, why we always talk about maternal fevers and stuff like that. We need the body cooled. So,
Definitely. Interesting.
yeah.
So if there's a pregnant runner and she's are there any warning signs of like if she should slow down or stop
That's a great
running?
question. Right. So any sort of pain, again, like we talked about, this is not a push through the pain. So any sort of pain, she should be stopping. Acute shortness of breath, dizziness, uterine contractions, any of that, it needs to stop. And that's a way for that mom to kind of know her threshold and to really maybe go back to her doctor and be like, okay, this is what was happening, this is what I was doing, this is what I felt, right? And then modifications need to be made. And that is going to look different from the first to the second to the third trimester as the baby's growing. As we know, like babies are making their own blood supply, so anemia is very common in pregnancy. So if the patient's anemic, different shapes of the joints in the low back. So those modifications need to be done.
Yeah. The uterine contraction one, I remember experiencing that my third pregnancy. I was on the treadmill and I think I ran like 7 miles. I was grinding out some ridiculous pace on there.
Right.
And I was not consistently training either. So this was all just bad news. And I remember like all day I was like cramping and I was like,
Yep.
what did I do that for? To like impress myself for 6 miles?
Right.
Like, but I
Yeah.
bet I was just dehydrated and I didn't get enough
100%.
nutrients, and so everything was just kind of cramping all day. But it's like a hard lesson, and I hope that most of us don't learn that like in that
Right.
circumstance. But
Right.
I love that you mentioned that one because that one for me is like a huge one. Like if I usually feel the cramping, that's usually me going over my threshold. So it's
Right.
like a good
Right.
indicator.
Yeah, for sure. And I think that everybody's threshold is different.
Yeah.
Whether, you're a recreational runner, because like we said, I mean, you're a runner if you're running, right? So if you're a 5K, 10K, or just a recreational around the neighborhood, and so everybody's going to look different. And if you push past that threshold, your body will let you know. But
Yeah.
thankfully, the body will let you know, and as long as you recognize that and stop, then it will correct itself.
Yeah.
So it's the people that, right, like we get in our head.
Yeah.
We're like, I can do this. It's fine. I can do this. And then they keep going, and that's where they get into trouble. But I see patients that do that with anything. Golf, tennis, running, right? They all are like still trying to do all the things, and they come and they're like, "Oh my God." And then I contracted all day, and I was like, "And that was too much."
Oh
Yeah.
my gosh.
Like, can we not golf 36 holes and walk all day in the heat? Like, come on.
Oh my gosh. I can't imagine doing that with a belly. Oh my
I
gosh.
can't
Golf is
either.
hard enough to as it is.
I can't even golf not pregnant.
Me too.
Same.
You know what I mean? This is not, I mean, I think people look at runners and running in pregnancy, and I'm like, look at the golfers.
Yeah.
I never even thought about that. That's wild.
Yeah. I mean, so it's every single thing. It's every single thing. You have to listen to your body. You have to make those modifications. You have to be smart about it.
Yeah. And I think even recognizing too, like 1 week may feel awful and then the next week may feel great, right? Like I think where we
Absolutely.
kind of lose, like we can lose courage, or like excitement to the sport when we're in our pregnancy because we're like, wow, yesterday was brutal. Like I remember waking up Tuesday morning and I feel like a train hit me. And I was like, I'm only first trimester, barely first trimester, and I'm already feeling this way. And then like a day later, I was like, oh, I actually feel pretty good today. Like
Right.
it's just this like constant roller coaster. And I think just
Right.
like reminding, ourselves that like today may be a great day and then tomorrow may be an awful day. And that's where we pull back or we take a rest day or, we do the run walk or we run for 3 miles
Yes.
instead of the whole 60 minutes or whatever it is,
Right. You're exactly right. Like, so many of us have the week set up, right? Like I'm going to try to
Yeah.
do all these different things, but you have got to listen to your body. You have got to listen to your body. You may not have slept that night. The nausea may be hitting hard, something like that. Like you have got to be able to pivot and just change those things up and be just very flexible with what your routine is going to look like.
Yeah.
Yep.
That's so true. And I mean, if it's your first baby, it's a great time to learn that being flexible is kind of the name of the game when it comes to having kids. So
Welcome to the rest of your life.
I know.
true.
That's what I say it always. Welcome to the rest of your life. Like,
And it doesn't change your postpartum.
Like, you don't even realize how good they have it on their first pregnancy. Like, you could take a nap when
I
you're
know.
one, you know? You have no
you
idea. You can sit down. So nice.
do you ever tell your first time mamas like take advantage of this moment?
You do. It's like I do. But you know how it was when you were with your first pregnancy? Like, you have no idea because you feel like crap. You're like,
Yes.
this is it?
Yeah.
Like, I feel like crap. You want to sleep all the time, like your bedtime 6 p.m. And so you're just like so focused on like that day
Yeah.
that you don't realize how good you have it,
It's so true.
right? Until you become pregnant again and you have toddlers.
You're like,
Yeah.
Oh my God. There's 2 3-year-olds and I am pregnant again.
Oh my
that's
gosh.
so rough.
That's wild. Yeah, twins for
Yeah.
your first pregnancy.
I mean, I feel like it was good because it's trial by fire. We didn't know any different. So then when we had my daughter, it was like a unicorn baby. I was like, I don't know why people think this is hard. There's only one. And she was
Yeah.
full term and fat and ate. My husband was like, if I knew they could be like this, we would have had 20. I was like, oh, no, we wouldn't have. But
Oh my
he's
goodness.
like, this is so easy. I'm like, as I'm breastfeeding at 3 a.m. He's like,
Yeah.
I know.
right? Like, yeah, it's so easy.
Oh, that is such a curveball though. Like so my twins were my 4th pregnancy. I'm like having to count. And it like I never downplay how hard. Like I will say every other pregnancy was wasn't that bad. But with my twin pregnancy, I was like, I will never downplay how rough that was. I was sleeping upright because I had
yes,
such bad
same.
acid reflux that I would wake up in the middle of the night throwing up in my mouth. Like
Oh no.
One of my best friends, who is my partner, who I delivered all of hers, she's delivered all mine. She was pregnant at the same time with a singleton, and I was pregnant with twins. And it was our first pregnancies. She was running every day, and I was like sucking wind walking down the hall.
Yes.
And I went to one of my other partners who had 4 kids, including a set of twins. I'm like, did you feel different? Like with the twins? She's like, oh my God, yes.
yes,
She's like,
you're not doing it wrong.
she's like, you are no, like you are just fine. That's normal. I'm like, okay. And then I was pregnant with just one. I was like, oh yeah, I feel good.
I know the room that
I
you
feel
can breathe.
good.
Well, I remember going into my OB appointment and they were like, you're measuring full term for a singleton at 20 weeks. And I was like,
Yeah.
I'm only halfway and I'm already
I'm gonna
full
get
term.
bigger.
I know. Oh,
Oh my.
it was
This
awful.
is like a
And
house.
yes, you would-
That's what it felt like.
the steering wheel of your car is like all the way out here
Yeah.
because your belly doesn't fit.
Oh my
Like, I
gosh.
remember going to a Garth Brooks concert. We had floor seats, and I was like, oh, just suck it in. I'm trying to fit my seat. And I'm like, oh, one second. These people behind me kept like handing me bottles of water. Like they thought I was going to like give birth in front of them. Like, I'm okay. I'm okay.
That is crazy.
Wild.
Yeah.
Oh my gosh.
Oh,
That's
Yeah.
so funny.
Oh, the fun stories we could tell, right?
I know.
They're so good
Yeah.
though. They're so
Yeah.
good. Well, should we talk about postpartum?
Let's
Yes,
talk about
let's do
postpartum.
it.
Yeah. Go
Um,
ahead.
oh, okay. No, well, do you want to start it off?
Well, sure. I mean, I know that we had talked about a couple things, and I know that one of the big questions is the 6-week rule, right?
Yes.
Like, yeah, I think that's what a lot of people says. The 6-week postpartum rule for everything is just like a generalized rule. And again, it has to be individualized to each patient and each delivery, right? So a vaginal delivery is going to be a very different recovery than a C-section. I will say that I don't like my patients doing much more than just basic walking for the first 3 weeks for a vaginal delivery and 4 weeks for a C-section. And after that, and I've really gotten into having a lot of them start doing a lot of like postpartum breath work, stretching, mobility, different things like that before we start getting into everything else. I was like, walking is fine. Breath work is great. Mobility work is great so that we can start to strengthen our core. Because if we jump into those things too soon, right? Like you guys know, like your core is such a huge component to running. And that core is not at its best right after you give birth. And that can cause injuries to the back, and you just don't want to get injured because you're trying to do something too fast. Also, any sort of tear that you might have had, right, from a vaginal delivery, those sutures take 6 weeks to heal, and you do not want something
Oh,
to
yeah.
open up that has to then be repaired again, a second time just because we wanted to go out and do it. So I always say, if it's like the best case scenario for a vaginal delivery, not a bad tear, not a lot of blood loss from the delivery, so anemia, then walking, the first 3 weeks, and then gently starting to ease back into those things. C-section, any sort of abdominal, intra-abdominal surgery, that's going to be pushed out a little bit longer. So, but there's great things that we can start doing to start strengthening the core and the pelvic floor that are not necessarily pounding the pavement quite yet. So, but it all depends on what kind of delivery it was.
Yeah. Are there things that people can do even while they're pregnant to prepare their pelvic floor, or and it carries over, or anything like that, or are you
Right.
starting fresh, like completely?
No, absolutely. So, Kegel exercises and strengthening the pelvic floor are fantastic. Doing those while you're pregnant and continuing to do those right away postpartum to strengthen your pelvic floor are really helpful. I also refer a lot of people to pelvic floor physical therapists that are going to evaluate that pelvic floor and teach people how to do that. I think it's so great that insurance carriers have really jumped on board with this
Oh,
because, yeah, so at least in Nebraska where we are, so we're sending the majority of our postpartum moms to pelvic floor physical
That
therapy.
is awesome.
So, which never was the case. Like when I was having my kids, or probably at the beginning of your guys' pregnancies, because people wanted to do it, but you couldn't get it paid for. You
Yep.
already have all of these expenses of the pregnancy and the delivery and a new baby and other kids, and then now you're supposed to pay for physical therapy
I
too,
know.
right?
I
But
know.
it's such a helpful thing, and we're seeing carriers pick up it much more now, much more.
That's so cool to hear.
yeah.
Yeah.
It
Also, like breastfeeding, right? Like breastfeeding, and you need that support when you have those big breastfeeding boobs, right? You miss
Yes.
those.
That's so cool.
Um,
I miss those.
I do miss those. I'm like, oh God, they look so good
I
then.
know. That's so
No,
funny.
it's very different.
Yes.
Yeah.
But you need a lot of support. So,
Mhm.
also, I did read a study too. When you start getting into those, down the way into those higher threshold runs, right? You can make more lactic acid, and it can actually make the milk taste a little bit different.
Oh,
Yeah, so the
interesting.
baby may notice it. So they do recommend, like, if you're breastfeeding and you're actively running, actually breastfeeding before you go out for your run,
Mm.
which will make you feel better because your breasts are emptied. And then the lactic acid will clear um, by the time the baby is ready to eat again. Isn't that crazy?
So crazy. That's
That's
wild.
Yeah.
I feel like I
insane.
read that because I used to pump, and then my daughter didn't end up taking a bottle, but I
Uh-huh.
before I ran, just in case, and because I feel like I
Yeah.
probably read about it at the time, and
Right.
yeah, well, at the time I was like super into everything, like the higher fat milk and all of that. So
Right. Right.
that's
Right.
super super interesting. I mean, it
Yeah.
makes sense if you're,
It totally makes sense.
that.
Yeah, it totally makes sense. And
Yeah,
I'm sure, like, if you step some babies are pickier than others, right? Like that's
yeah,
just the truth of
Yeah.
it too. Some babies they don't care.
yeah,
Yeah.
yeah.
And
Yeah.
I could imagine even just having those 3 to 4 weeks, like you said, just focusing on building your milk supply very solid, like before, because
Yes,
I feel like
yes.
for me, like once I start incorporating exercise, usually it's strength work for me in the beginning, and then I ease into running. I can take my milk supply if I'm not on top of hydration, like
Oh,
hydration or
100%.
getting enough carbs. Like a lot of times people are like, oh, I'm postpartum, I want to lose weight and I want to do it
Right.
quick. And it's like if you're
No.
breastfeeding, you can't. It's almost like marathon training. It's not the season to lose the weight yet, until your
Absolutely.
supply is very solid. And it can be scary. And so I think that 3 to 4 week advice to not run or to even just ease into exercise is smart, even
Right.
for
Yeah.
breastfeeding, right?
Yeah. And as we know, right, like those first couple weeks are like the emotions are high,
Yeah.
everything's all over the place, and you're just you're trying to, do it all, right? It's
Yeah.
just so overwhelming. It's so overwhelming. But I do tell my patients especially like it's good to be outside. Like it's
Yeah.
good to just and the babies like to be outside too, right? If the weather's appropriate.
Yeah.
Right? And so just like to moving your body in ways that still feel okay, but slow. And as your body just transitions and those emotions get better and the milk supply develops and we feel just like stronger in our own skin, because right away you're like, what just happened? Right?
Yeah.
Yeah,
What just happened?
that's
Yeah.
true. You get a whole new body, even though it's the same
Yeah.
body that you had.
Yes.
Yeah.
Yeah.
Yeah. It just lays very different.
It does. Yeah.
Everything.
Yeah.
Yeah. Somehow I'm still experiencing that.
Yeah. Same.
Oh man.
Yeah.
That's so funny.
Well, there's a question. It says, how can new moms tell the difference between normal postpartum discomfort and a red flag injury?
Ooh. I think it all depends on like what a red flag injury of what part of the body, right? Like, are we talking about injuries from running or are we talking about injuries from like a perineal tear? So I do think that the body is going to move differently postpartum and different like aches and pains. We always talk about like round ligament pain, things shifting and moving. But if you ever feel like a sudden onset of pain or anything like that, then that needs to be evaluated for sure.
That's good to
Yeah.
know. Yeah.
Yeah.
Yeah, that like postpartum first time it's so tricky because everything is new, right? Like all the feelings are new,
Right.
all the experience as a whole is new. And so you don't really have anything to compare it to prior, to know if it's safe or not.
Right. Right.
Yeah, I think you're so excited to get out there and give it a
Right.
try, It's like, is this normal? I think because sometimes you can just feel that heaviness too. Plus, a lot of times
Right.
you gain more than the 30 pounds
Yeah.
during your pregnancy, so
Right.
you're heavier, but
Absolutely.
it's sitting differently. So I think that is probably it would be very easy to push through something that you can write off as like, oh, this is normal heaviness, but
Yeah.
Right.
I think
Right.
because there's also I don't know I don't know if I didn't have like access like what lack of access I had to postpartum running, but I had no idea what I was doing out there. Like I just
Right.
went out, gave it a try, and I was like, I think this is fine. And so sometimes I'm like, especially during my second pregnancy, I was like, I wonder if I'm experiencing this discomfort because of what I did the last time around.
Right, right. I think that you definitely have to start the program very small again. So I always tell my patients, like, you are clear to start running, but we are not going back to like what it was pre-pregnancy right out of the
Yeah.
gate, right? Like it is, and I think that would be a good thing for what we talked about before, maybe run walk intervals or different things to just test the waters. Like, how does this feel? Does this feel too heavy? Does my pelvis not feel supportive? Am I having a lot of incontinence? And maybe need to strengthen my pelvic floor right before that. And those are the things that you need to bring back to me. Be like, okay, like I'm leaking urine all the time. Okay, we have got to get you into pelvic floor before we really start, pounding the pavement and running. We have got to get the core strengthened. Like you talk about doing that strength training immediately, not immediately, right? But
Yeah,
working
when
on
you're
that
cleared. Yeah.
is, yes, is so helpful.
Yeah, I think that's a big one. I get that question a lot, and like I don't say it in like a boasting way, like I've never peed myself like postpartum, but I think it's because
Right,
running was never a priority for me through my childbearing years until just recently. But I
right,
look back and I'm like, it's crazy. Like I can't tell you how many questions I have from women, which rightfully so. They ask like, "Hey, like what do you do with the peeing issue?" I was like, "What?" Like if I like
yeah.
really have to pee
Huge
and there's
issue.
nowhere to pee, but like I would hold it. So it's just it's crazy how common it's almost become that women think that that's normal to feel that way
Right,
postpartum.
right,
Yeah.
right. And it's definitely, you've got to work. You have to work on the pelvic floor with the stress incontinence, right? So stress incontinence is any leaking of urine with any sort of stress. So running, laughing, jumping, different things like that the bladder just cannot hold. It's involuntary. And I think that's why like pee underwear has a market now.
It's
Right?
crazy. Yeah.
Right? So, which I think is great.
Yeah.
Just like period underwear. I think those are like the new greatest things for kids, or for younger women, older women, whatever too. But pelvic floor physical therapy is so important postpartum.
Yeah. I wouldn't have known anything about that when I
I
had
know.
Grayson, and that he's only 5, which is crazy.
Yeah.
But I
Right.
also, a lot of my friends had children, like their kids are like 13, 14 years old now. And so one of my good friends, she always makes jokes. Every time she laughs, she pees herself. So to me, it was like that was the normal, and it is still the normal. And so I would never say
Right.
anything to her because it's been 13 years now that
Yeah.
she had twins too, but they were by C-section. And so I was always like, oh, I wonder why she pees herself, because she had C-sections for all 3 of her kids.
Right.
But, you know,
But even still, there's so much just trauma of
yeah,
being pregnant to the bladder,
yeah,
right?
Crazy.
Because the bladder sits
yeah,
right on top of the uterus. And so, like, all of that trauma during the pregnancy and the dissection of the bladder during the C-section,
oh yeah.
yeah, lots of issues with that.
It's such a massive surgery. It's just
I
Yeah,
know.
unbelievable. Like, yeah,
yeah, absolutely.
yeah, just the
People
recovery.
think that because something is common,
Yeah.
that
Yeah.
it's not major, right? Like, oh, we'll just go in and have that, but it is a major open abdominal surgery. And then people think that you're just supposed to bounce back like nothing ever happened. So, and it's like, no, you have got to treat your body well. Like you just grew a human, you grew a placenta, your body changed completely. You either had a vaginal delivery or a C-section. Both are hard, and you've just got to give some grace.
Yeah.
So,
I think maybe highlighting over just like what does our body internally look like after we have a baby. I think sometimes like we don't see
oh,
that. And
right,
I came
right.
across a post like maybe 2 years ago, the plate wound or whatever. But I think it'd be good to talk about that because I think just putting into reality like what is happening inside. It's just like a marathon, right? Like most people, they'll run a marathon. They're like, oh well, I'm seeing on social media somebody's running a marathon like next week after they just ran a marathon. It's like no, the like molecular thing that it does to your body if you race it at
Right.
least is a big, big ordeal on your like organs, your whole entire neural system. And so
Right.
with having a baby, what does our body look like internally? Like that first
Right.
fresh 24 hours of having a baby.
Right. Well, so it's so funny, right? Because when you have the baby, everybody looks at their body and they're like, "Why do I still look
Yes.
pregnant?"
Yeah.
I said the
I
same thing as an obstetrician. I'm like, "Why do I still look this pregnant?" So,
And it's squishy, not hard anymore,
Yeah.
which is really
yes,
sad.
yes, very doughy. So the uterus, right? So the uterus grows to the size of a watermelon, right? So the uterus is the only muscle that can grow that big and then go back down to normal. Could you imagine if our heart did that, right? And that's why I always tell my husbands that's why females are the superior gender. Um, so the uterus after the baby comes out clamps down, but we're still talking like, I mean, cantaloupe size, even with a baby being out of there. So you still have a very large organ inside of your body that is not at a normal size. The blood flow to that too is getting about 1/5 of every single heartbeat. Okay,
That's
so if you feel like the
crazy.
rest of your body, just the uterus is getting 1/5. So now and as the external, right? Most people can see the external, like everything is stretched out. Your rectus abdominis muscles are all stretched out. The fascia is all stretched out. And so everything, I tell my patients when they come back at 6 weeks, because they're like expecting their bodies to look normal. I was like, it took you 9 months to get to this point. It is not going to bounce back in 6 weeks. It just is not.
Yeah.
And I mean, I tell a lot of it took me, and I was an active person, at least 18 months to like feel kind of okay in my own skin again. So, and by then you're having another baby. So it just
Exactly.
happens all over again. Right.
Yeah.
But it's on the inside, those things are still very large, and you just have to, again, give your body some grace as to the amazing thing that it just did and let that heal itself. It takes about 6 to 8 weeks fully for the uterus to go back to normal size.
Crazy.
That is
Yeah.
unbelievable. It's so cool.
Yeah. Yeah. It's the female body is insane what it can do.
Yeah.
Like it's I mean that's why I went into women's health, right? Like I
Yeah.
was just so fascinated by all the things that it could do and then go back.
Yeah.
Yeah.
So,
Yeah. And it does it on its own. That's the part that I will
right?
never get, like when I had my son and I was like, that's crazy. That is like he's just here, like
Right.
I didn't do that.
Did you ever like when you had your baby too, like put it on your stomach and be like, how did you
Yes.
fit in there?
Yes.
Right? Like,
Oh,
did
How
you
did
roll
you come
around?
out
Like,
of there?
how
Yeah.
did that all just happen?
Yeah,
It's such
so
a
true.
surreal moment, right?
is.
It's
Yeah.
so
Yeah.
surreal.
It's when you finally see them and they're like, doing their little kicks and their little spazzy movements though. It's
Yeah.
like, oh my
You're like,
gosh, this
that's what that
really,
was.
yeah. Oh, like, and you're like, oh, that's why
Yeah.
it hurts so much because you're
Yeah.
really strong.
Yeah.
Yeah.
My husband used to be like, oh my God, look at how much she kicks. I'm like, yeah.
Yeah. Yeah.
I felt all of that from the inside.
Yeah. While you were sleeping. It's amazing.
Oh, yeah.
Yeah.
Oh, well, I feel like I could talk about all of this forever because I have so many questions of like C-section versus, vaginal delivery. And do you approach like if someone is in their 6-week appointment, are you approaching their, like what you're looking for to clear them? Are you approaching that differently or no?
You know what? At a 6-week postpartum visit, not really. So only
Okay.
if they're pushing to do it before the 6 week, because at 6 weeks, things are feeling much better. But I do tell them that, I mean, with everything, like you've got to ease into the exercise, right? Like it's not going to be, sorry, this light is, there we go. It's like was glaring behind me. It's not going to feel the same. So I do think that a lot of how you feel is because of those huge cardiovascular shifts, right? Because you have all this fluid, you make all this blood flow for the baby, and then you go back and it's all trying to normalize out, right? That's why we kind of blow up like balloons and we're going to the bathroom all the time. And then finally at 6 weeks, we're like, okay, I'm feeling a little bit better. And the exercise is not going to feel exactly the same right away. So, but I clear almost everybody at 6 weeks if everything's looking okay, if they haven't had any sort of big wound infections. And again, really it's like, comorbidities, right? Like diabetes, hypertension, stuff like that. Stuff that we would be managing the whole time anyways.
Got it. That's great.
Is there any like myth busting you wish every like running mom would know? Like any like maybe a few that you can think of at the top of your head that you hear probably pretty constantly?
Let's see here. I think the heart rate thing, right? Like I think that is a big shift. I like my patients to know about the incontinence thing. And again, pregnant women don't have a disease. Okay.
Thank
We
you
are
for saying
not,
that.
Yeah.
like you are not this like thing that needs to be wrapped in bubble wrap and can't ever lift or do anything ever again. You are a badass human being. And so I think the myth of like, oh, well, I can't lift and I can't do this and I can't do this. I think that's the biggest thing. Yes, you can. You can do all of this stuff safely if you talk to your doctor about this.
I love that. Yeah.
Yeah.
That's a big one, I think. And then we discussed the belly band, right? Like belly bands are okay.
Yeah.
They're
Yes.
encouraged.
Yes.
Okay.
Yeah, so yes, so as far as like equipment, like there's specific running belts like
Yeah.
made to support your belly and to support your low back when you're running. I'm a huge fan of compression socks,
Okay.
pregnant,
Oh,
like
okay.
running or not running,
Mhm.
because main you retain so much fluid, right? So you kind of really swell up a lot, and those compression socks really help. And so, big fan of the compression socks. Um, but yeah, those are the two things. And then hydration. So if you normally didn't pack water for a 3 mile run, you need to be packing water.
Okay. Yeah.
So you should never be running any sort of distances without being able to have hydration on board.
That's okay. That's good to hear.
That's
Yeah.
great. That's good to know. You got to bring water now. Anytime we go running, Shanna, I'm going to be like,
Yeah.
"There's your water."
I love those little handhelds,
I
Yeah.
do
you
too.
know.
Yeah.
Yeah, I mean, and I do just even short runs because I just get thirsty a lot.
Yeah.
Yeah.
So, again, these are not the runs that you're pushing through it, right? And I think like old school runners, like, I don't need water, I don't need nutrition, I
I
don't
know.
need any of this stuff.
Crazy.
Like,
Yeah.
it's so crazy, right? Like
It
that is
is.
not
It's
why
like
you're pregnant.
for me it's like it's 2025. Like why would you not want to like perform the best you can or feel even
Right.
optimally as best as you can? Like
Right.
Yes.
it's
Right.
not a flex to not eat. It's not a flex to not drink. I don't know.
Right.
Like the
Right.
water one is like I do need to be better at the 60 minutes and below runs. Because I do like I'll have a migraine after a run and I'm like I haven't had enough sodium. I haven't had enough hydration. Like and I know it. I know it instantly. Like my husband's always like, oh, go take some go take some medicine or whatever. And I'm like, no, it's because I didn't drink. Like that's why I
Right.
literally have a
Right.
migraine. My body is telling me
Right.
I'm lacking in some department. But
Right.
and
Right.
it's just humbling, you know. It's tossing that ego to the side and knowing that like you do have to plan a little bit more when you get out the door
You
now.
do. You do.
So
Well, and
Yeah.
right, like that's moms and runners. Like we're the
yeah.
ultimate planners, right?
Yep.
Like I became better at running after I became a mom
Yes.
because it was like, okay, when am I going to fit this in
Yeah.
between work and soccer and basketball and volleyball and everything,
And
right?
delivery
Before,
babies.
and delivering babies
Yeah.
that don't like to ask me.
Yeah.
Is it a good time for you? Is this in between soccer games?
Yeah, just in
Yeah.
between.
Oh, that's so cool.
Before you used to just be like, oh, I'll get a run done today. Now it's like,
Yeah.
okay,
Yes.
I have between 5 a.m. and 6:30. Let's go. Get
Yeah.
out of bed. Go. But you
Yeah.
do have to plan more when you're pregnant because you have to have that hydration. And people also think, right, with like cooler temperatures that they might not because maybe they're not sweating as much. You absolutely have to have the hydration even in the cooler temperatures.
I love that.
Yes.
Yeah.
Yeah.
Because you probably don't notice the sweat as much, right? It's kind of
Exactly.
a lot
I mean, I don't
quicker.
know how cold it gets for you guys, but here, I
Yeah.
mean, it'll
Oh,
get
yeah.
really cold. And you just, when you're cold, you don't realize how much you're sweating until you take your clothes off and you have soaked through all of
So
them.
Drenched.
true.
Yeah.
That
Yeah.
is so true. Yeah.
Oh man. Well,
So,
where can our audience find you? Like at
yeah. So on Instagram, I'm under Stork Mom MD. That's my Instagram handle. I need to be better at being on social media, right?
yeah.
In
Yeah,
my
you were very busy.
free time, in my
Yeah.
free time.
You're
Yeah.
So, but that's my Instagram handle. I definitely think, now this is the second podcast on running in pregnancy. I think maybe is what the platform needs to be more of, right? Because
Yeah.
those are my two favorite things.
Yeah. And I
Definitely.
mean, you're an expert at it, so you need to,
Yeah.
yeah,
Right.
you need to share about it because there's only so much, like, we can talk about personal experience so much, but like, I had two
Right.
amazing pregnancies that had amazing deliveries, and I was right back to running. So, like, there's only so
Right.
much I can say, and
Right.
everybody's experience is just so different, and so to be able to
Absolutely.
offer a bird's eye perspective of, I've had patients that have experienced these things,
Yeah.
and from a medical
Yeah.
perspective,
Yeah.
like sharing it is so important.
I have a lot of patients that are like, why don't you make these videos or put these up? And I was
Yeah.
like, because I'm old. I don't know how. Just kidding.
You
You're like, because I don't have free time. That's
It's
And
why.
I was like, when am I supposed to do
I
it?
know.
yeah.
Like 3 a.m.? I don't know.
Catching a baby, and you're like, and that is a
Yeah,
runner.
and that, yeah. Like go running into a delivery and
I
like,
know, there
you
you
know,
go.
show the different shoes that I have on. Like I'm gonna deliver this baby in these. These are my
Oh my gosh.
C-section running shoes. These are my
I'd watch that. I
would
would live
too.
Oh my
vicariously.
God, maybe that would be funny. I have like so many pairs of running shoes. I'm obsessed
That's
with
so
running
funny.
shoes.
You
That would
should.
be
love
funny.
it.
Just do
Yes.
shoe reels with delivering babies.
Shoe brands will start reaching out to you.
I know, that's what I'm actually looking for.
I love it.
Yeah. Oh my gosh,
Oh
that'd
my
be so
gosh.
fun.
Well, Brianne, thank you so much for joining us. Like this
Yes.
was so informational, and I feel like, I mean, I already had my two babies and I learned a lot, and I'm like, I wish I
Yay.
could go redo it.
Yeah, yeah.
Yeah, thank you so much. And yeah,
Absolutely. It was great to be on. Thank you guys for having me.
Yeah, I'm sure we'll have you on again in the future. We would like to bring
Yeah,
our experts back, like for a
absolutely.
second round. So,
Absolutely.
yeah, maybe we can get some listener questions in as well. More
Yeah.
Yeah, for sure.
Yeah.
Yep.
Well, you guys, thanks everyone for listening to the Moms with Moms podcast. And since we are building that new platform, we really, really appreciate it if you could rate, subscribe, and share our podcast with another fellow mama. We are always looking for more moms to shout out. So please message us. We read every single one of your messages. We try to respond to everything. And so if you have someone that you know or you want to shout yourself out, go for it. Just find us at Miles with Moms podcast on Instagram. And yeah, we would love to brag you up. So thank you guys so much.
Thanks.
bye.
Bye.